Making yourself less vulnerable during the COVID-19 pandemic should be a goal for all of us. And this morning, Dr. Todd Muncy is here to discuss the numbers relating to COVID-19 and how you can better protect yourself. Morning, Doc.
Good morning. Glad to be here.
I'm glad you're here because you've had a little accident. You broke your leg.
I did, and I found out that hiking's a tough sport.
It can be. It can be. Accidents happen, though.
They do.
And that's proof positive, right?
Absolutely. Yeah, you know, I'm glad we're here today because I get an opportunity to talk about some numbers. That the CDC's put out some things, and there's been people discussing it on Facebook and in social media, and I kind of wanted to bring, you know, a different slant to those numbers.
Right.
Because there's two different populations talking about it.
Right. We've got those numbers up right now. Let's talk about that. The first one, currently infected patients, over 2.5 million people there.
Absolutely. That's a big number. And we got to understand that viruses come along and they do affect a lot of people. We've had viruses for years, most of our life. And they do affect a lot of people. But it's that second number I want you to look at up top there. You look and you see that 14,000 are serious or critical out of that.
Right.
That is a positive. Because that number tends to fluctuate every day, but it has fluctuated from 20,000 down to 14,000 now, and that's something that means we're getting closer to doing better with this virus.
And we look at closed cases in the United States, a little over 4 million there,
right.
But there's some news there that we want to share with folks as well.
You know, you see that 198,000, it's probably closer to 200,000 deaths, and that's where the confusion comes in, because there's two thought processes. You have one process that says, hey, people would not have died if it hadn't been for COVID-19, right? Because the CDC put out some numbers that said all these people died, but 94% of them had 2 or more comorbidities, and said that only 6% didn't have any issues other than COVID-19. Well, in that statement, some people say that if it hadn't been for COVID-19, then these people wouldn't have died. But also, there's the thought that had it not been for those comorbidities or other diseases, that these people wouldn't have passed away. You know what? Both are true.
Right.
Because COVID-19 did affect these patients, and these are the most vulnerable population. Right. It affected these patients, and it was probably part of the primary cause of them passing away. And nobody wants to see a family member pass away in that instance, or any other instance for that matter of fact. But we have to understand that, you know, whenever we live an unhealthy lifestyle, that it does affect us permanently. But the positive note behind all of this is if you look at that number, that other number that's on there, the 4 million who survived it out of the ones that we have reported answers on or reported cases. That number's likely higher, because some states don't report their recoveries the way they should. And that number likely goes up. And that's a positive note, because that means our medical professionals and people are you know, showing some healthy signs of surviving. So when we look at this disease, what do we learn? What have we learned from this? Is that we learned that lifestyle choices and being vulnerable cause a big problem when you have it.
We talked about you were going to give us some ideas on being less vulnerable. I mean, I think there's a pretty good section of the population that is vulnerable.
Yeah, there is. And you know what we're looking at with these is people that have type 2 diabetes, that have heart disease, that have, you know, certain cancers, Alzheimer's or dementia, things of that nature. Some of these are not preventable. Some of these are just things that are going to happen in your life. But the vast majority of these comorbidities or these other diseases that are affecting these people are lifestyle choices. And we really need to start looking at that. If we've learned nothing else from this virus, nothing at all.
What should we be doing? We got about a minute left here to get ourselves out of that more vulnerable category to less vulnerable.
We need to start looking at our diet and eating right. We need to start looking at, you know, if we have type 2 diabetes, getting out, exercising, eating right, getting plenty of sleep. The hospital associations have also put out some preventative measures for COVID-19 in the way of vitamins and minerals and things like that. Vitamin D, vitamin C, zinc, and Q-certain all have an effect on this virus and limiting your chances of getting it. But reality is what we've got to do is start living a healthy lifestyle and looking at our nerve system as well. As chiropractors, that's what we deal with, and we understand that it controls and coordinates everything we do. If it's not functioning properly, you're not functioning properly. In this last couple of seconds, what I'd like to do is offer all your viewers the opportunity to learn how to become less vulnerable in a 1-hour free webinar that you can find on our Facebook page and on our website. You can sign up for it. It's a free webinar starting tomorrow at 1:30. It's written and done by the guy who wrote the 100-Year Lifestyle.
Right.
And he's going to give you some really good tips and ideas on how to stay healthy in the midst of a pandemic.
All right, Dr. Todd Muncy, thank you for your time today. Let's give you some information right now, folks. It is Muncy Family Chiropractic and Sports Health Center. There's that website right there at the bottom of the screen he was talking about. If you got more questions, give them a call right there. They're located in Bristol. Give them a call today.